Good morning, classmates. We are the group 3 and we are assigned to do a report about our love exercise 22, which is nerve reflexes. This exercise describes the organization of the human nervous system and relates it to the concept of reflex arc. The first activity describes the nature of the reflex arc and the manner in which it elicits a response called reflex in an effector. Organization of nerve pathways. The arc begins with receptor, a specialized cell or a cell projection which is stimulated by a change in its environment. For example, some receptors in the skin are sensitive to heat while others are sensitive to pressure. If stimulation of the receptor was significant enough to initiate an action, potential in the afferent neuron, the signal is transmitted toward the central nervous system or CNS. The afferent or sensory neuron brings the signal into the brain or spinal cord. At the peak of the arc, where the signal is turned around, the afferent neuron. This is a three-neuron arc. The afferent or motor neuron then proceed to an effector. An effector is a muscle or gland inverted by motor nerve. The effector responds in some way to nerve signal, perhaps by contracting or secreting a chemical, synthesizing the component parts of the reflex arc. We see that a stimulus at the receptor results in a reaction by an effector. A simple example is pinprick. The causes a reflexive withdrawal of the pink limb. Reflexes may be more complex with the sensory information being relayed to several different points in the central nervous system. Before triggering a motor response also, more than one sensory neuron may converge on a single association neuron. Autonomic reflexes typically involve two efferent neurons, whereas somatomotor reflex involve only one efferent neuron.
Reflex arc, the brain mechanism that governs a reflex, is known as reflex arc. Most sensory neurons invertebrate synapses in the spinal cord rather than passing directly into the brain. This enables faster reflex action by engaging spinal motor neurons without having to wait for messages to go to the brain. Receptor is a molecule, usually a protein, that receives signals and transmits them to a cell. Small molecules bind securely and specifically to their receptors, such as hormones outside the cell or second messengers inside the cell. Afferent neurons, also known as sensory neurons, are the nerve fibers that carry sensory data from the outside environment into the brain. Sensory information can include the sensation of touch, pain, and temperature, as well as the particular senses like vision, hearing, smell, or taste. Efferent neurons, also known as motor neurons, are nerve fibers that convey information from the brain to the peripheral nervous system, allowing an action to be initiated. They are, in other words, the neurons that instruct your body to perform a certain action, such as removing your hand from a hot pan. Effectors cause responses that restore ideal levels of core body temperature and blood glucose levels, for examples. Muscles and glands are effectors, therefore reactions may include muscular contractions or hormone release. One of two roots that emerge from the spinal cord is the dorsal root of the spinal nerve, also known as the posterior root of the spinal nerve or sensory root. It travels to the dorsal root ganglion after emerging straight from the spinal cord. The ventral root and nerve fibers join to form a spinal nerve. A dorsal root ganglion, also known as spinal ganglion, is a group of neurons or a ganglion located in the dorsal root of the spinal nerve. The dorsal root ganglia houses the cell bodies of sensory neurons known as first-order neurons. The afferent motor root of the spinal nerve is also known as the ventral root of the spinal nerve, anterior root, or motor root in the anatomy and neurology. The ventral root meets the dorsal root at its distal end to generate a mixed spinal nerve. Any of the many paired peripheral nerves that emerge from the spinal cord in vertebrates is known as the spinal nerve. There are 31 pairs in humans: 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Each pair links the spinal cord to the different part of the body. Nerve branches or spinal nerves, the dorsal ramus, ventral ramus, meningeal branches, and rami communicantes are all branches of the spinal nerves. Spinal cord. The spinal cord is the lengthy band of tissue that resembles a tube. It is the link between the brain and your lower back. Nerve signals travel from your brain to your body via your spinal cord. These nerve signals aid in the perception of feelings and the movement of the body. Any damage to your spinal cord might have an impact on your ability to move and function. Within the central nervous system, white matter is the tissue that allows messages to travel between different sections of gray matter. The fatty substance or myelin that surrounds the nerve fibers gives the white matter its color. The gray matter is where the actual processing takes place, while the white matter is responsible for communication between gray matter sections as well as between the gray matter and the rest of the body. The gray matter neurons are made up of neuronal cell bodies and dendrites.
Stretch reflex demonstrations example suspected of having some type of nerve damage. If the reflex shows an abnormal reaction or no reaction at all, the damage to some component of the reflex arc is suspected. The patellar or knee-jerk reflex is mediated by a two-neuron arc centered in the spinal cord. These spinal reflexes involve L3 and L4. Have the subject sit on the table with the legs dangling above the floor, to the knee sharply with a reflex mallet at the ligament just inferior to the patella. The top stretches a quadriceps muscles in the anterior thighs, stimulating stretch receptors located in the muscle. In response to the increased stretch, which normally would occur only when the muscle load has suddenly increased, the muscle contracts and extends the lower leg. In the demonstration, such as a reaction seems strange but in normal circumstances, the patellar reflex allows the quadriceps muscles to reflexively increase its strength of contractions in response to increased load. Biceps reflex or spinal reflex involving C5 and C6. Have the subject sit with elbow flex at 90 degrees and palm downwards. Put your thumb on biceps tendon, press gently at the angle of the elbow. Tap your thumb with the flex mallet flexion of the elbow in the normal response. Triceps reflex is a spinal reflex that involves nerves C6 and C7. Let the subject lay down with an arm across the abdomen, supporting the subject arm elbow at 90-degree angle. Tap the posterior surface of the upper arm proximal to the olecranon. Lower arm should extend as triceps branchi. Muscle reflexively construct. Last is the Achilles reflex or ankle jerk, a spinal reflex involving S1 and S2, and results in plantar flexion of the foot. Have the subject kneel on a chair facing away from you with the toes pointing toward the floor. Tap the middle of the Achilles or calcaneal tendon with a reflex hammer. Cutaneous reflex are those that result from the stimulation of cutaneous or skin receptors. The plantar reflex involves cutaneous receptors rather than deep receptors in muscles or tendons. Position subjects barefoot with the lateral surface resting on table or chair. Demonstrate this reflex firmly sweeping the handle of the mallet along the lateral region of the sole. Normal response for adults is toes flex. Babinski response, the toes extend and move apart. This is abnormal in adults but is normal in infants up to 18 months. Nerves are fully immediated. Another cutaneous reflex is abdominal reflex. Have the patient lie supine, expose the skin using the handle of the mallet, sweep gently along the anterior lateral aspect of the skin. Move in superior to inferior. Possible abnormal spine reflexes, hyperlexia, exaggerated response, damage or disease motor areas in the CNS. Hyporlexia, inhibited response, degeneration of the nerve pathways, voluntary motor control, and other factors. Look up Babinski's sign and Hoffman's sign. Cranial reflexes, another type of reflex mediated by the brain. Pupillary reflex centered in the brainstem, dimly lit area. Subject looks straight ahead. Shine the pen light on subject's left eye, 5 to 7 centimeter. Look for changes. Diameter of the pupil give the advantage of this reflex, consensual reflex.
Nerve reflexes. First, patellar. The doctor examined the patient who suffered a stroke affecting the left side of the brain. When the doctor strike directly on the tendon, the patient responds in his right patellar is hypoflexia, while the other side is normal reflex. Second, biceps. Doctor examine same patient who suffer a stroke. When he strike the bicep, the muscle shorten and forearm flexes, and when he put his thumb on the bicep tendon, the strike his thumb normal reflexes. The response he do again the same procedure in the other side, which is same response as a normal reflex. Third, Achilles. The doctor examined the same patient who suffered a stroke affecting the left side of the brain. When he strike the right foot, the response is hypoflexia. Compared to the normal side, which is the response is normal. Third, tricep. The doctor identified first the critical part, which is finding the triceps tendon, and the muscle, which is allow the arm extend. And when the patient extend his arm, the doctor feel the tendon short. And when he strike the area of the tendon, the muscle respond normal reflex in the right side. When he examine the left side, the muscle respond increase compared the other side. Plantar. The doctor examine a patient who suffer a left side of the stroke affecting left side of the brain. When the doctor applied the stimulus to the lateral aspect of the foot and across the balls of the toes is the pubilicity respond and present the great toe with flex and the small toes will fan out and fine. It's happened when the doctor start examine the Babinski response while the other side no response. Abdominal. When the doctor examine from T5 to T12, the muscle contract, hypoflexia, and he do it again the same procedure. From T5 to T7, the muscle contract, hypoflexia, and also from T9 to T11, the muscle contract, hypoflexia. Pupillary. She examined the eye of the normal people, and when she examined the both eye is normal, which is both eye response constriction. Corneal. Both eye are response normal.
In our lab activity, we have put in order and fill in. First, we will go to put in order, which is we will arrange these components of the reflex arc in the order in which nerve signals pass through them. First, receptor, second, sensory neuron, third, interneuron, fourth, motor neuron, and the last is effector. And now we will go to fill in. Number 1. In infants, the Babinski response is normal when testing the plantar reflex. Number 2. When testing the plantar reflex in an adult, extension of the toes may indicate damage to the myelin somewhere along the reflex arc. Number 3. In the stretch reflex, a muscle contracts when the load increases. Number 4. The center of the patellar reflex is in the spinal cord. Number 5. A stretch reflex involving the biceps brachii muscle causes flexion of the elbow if the biceps muscle is stretched. Number 6. In the triceps reflex demonstration, the triceps muscle was the effector and one or more stretch receptor were the receptors. Number 7. In the Achilles or calcaneal tendon is tapped, one would expect the ankle to flex plantar. Number 8. When suddenly illuminated with the pen light, the pupil of the eye normally constricts. Number 9. Cutaneous reflexes results from the stimulation of sensory receptors in the skin. Number 10. Cranial reflexes are centered in the brain and involve cranial nerves. Number 11. The interneuron connects an afferent neuron to an efferent neuron. Number 12. A bundle of parallel neurons fibers in the CNS or central nervous system is called tracts.